All right. So, hello everyone. Welcome to another session. So, today's topic is a little different. It is basically on Robson's classification. And before we begin, those of you who don't know me, I am Dr. Reena Chawla, and I am a professor in Obs and Gynae, and I also am a faculty for NEETPG exams. So, what do you need to know for the NEET-PG or the INICET exam with respect to Robson's classification is what we will be discussing today. So, many of you would not know what Robson's classification is, but it's recently become important because number one, firstly, it has been asked in INICET 2020. It's come as a question, as an MCQ in the exam. And secondly, the WHO in 2014 has implemented this classification. So, it's basically a classification system used to group women who come for delivery, and it is mainly used to assess the cesarean section rates in different institutes. All right, so it has become more and more important because most medical colleges are now following Robson classification and in the labor wards, and thus it is an important part of the curriculum, and hence it becomes an important part, an important question from an exam point of view. And so let's discuss a few basics which you should all know. It's a little complicated. It's not a very easy topic to learn. So I thought let's spend some time on this and understand it rather than just simply mugging it up. Because once you have an understanding, it becomes much easier then to learn everything. All right. So let us start. Before we start, those of you who are new to the channel, please subscribe, like, share, comment if you have any doubts, anything at all, any comments, any doubts, any suggestions. Please let me know in the comment section. Now, why was this Robson classification introduced? So, as I said, it's rather than just mugging up or rote learning, it is always better to understand, have a slight understanding of the topic. So, don't think I'm boring you out here. I'm just trying to give you a sort of a viewpoint, or so this is a new topic for me also. To be honest, we have recently started doing this in our labor room, and understanding it took some time for me, and once I understood it, I could explain it to my senior residents. So it becomes a quite once I spend some time, it has now become much easier for me and my residents to understand and implement. The same goes for you. You may not be implementing it, you may not be working in the labor ward, but unless you understand the concept behind it, it will become very difficult for you to actually learn this. So once you understand it, learning becomes much easier. All right, so why was this introduced? Robson classification, you must have read in the paper, cesarean section rates are sky high, they're hitting the roof. So that was one of the major concerns. Not only in India or the world over, the WHO realized that rising cesarean section rates are a major public health concern. So how do we bring this rate low? Is by number one, we have to first do an audit. We have to first find out actually what's happening, in which group are the cesarean section rates actually rising. So to do everything, to bring everything together, to understand where the fault was, or where, if any, there was if any fault, where does it lie. The first important thing is to do research, to find out what is happening. Now, because there was no standard auditing mechanism for cesarean sections or for deliveries in general, the WHO went through multiple classification systems, and this Robson classification was already an existing system, but it decided to implement it and use it for all as a standardized sort of protocol for all institutions to follow, so that it becomes sort of a central now classification which everyone follows, and hence statistics can be compared, can be audited uniformly throughout the world. So that is basically the reason behind it. So it is necessary to have a tool to monitor and compare cesarean section rates in the same setting over time and between different settings. So this is basically called the 10 group classification, okay, also known as Robson, because he's the person who identified it. It has 10 groups. That's important to remember. So basically, the 10 groups are basically different types of women who come to the labor room are classified into 10 different groups. And once you classify them, all women are classified, not only those who are undergoing a cesarean section. Any woman who comes to the labor room, whether she's delivering normally or whether she's having a cesarean section, they are all grouped into one of the 10 groups. So it becomes easier to see how many cesarean section rates were in that group. All right, we will understand better as we go further. So as I said, unlike classification based on indications for cesarean, the Robson is for all women, not only for those who are having a cesarean. It's for all women who deliver. Okay, understand this point. This is a very, very important point. It is for all women who are delivering, and not only the women who deliver by a cesarean section. So primary comes in labor, she delivers normally, she also comes into one of the groups. A primary, say at the same time another primary comes for fetal distress, or for whatever reason she's taken up for cesarean, she also comes under this classification. So now we have two women of the same group, one had a cesarean, one had a normal delivery. So now we can see in this group there was a 50% cesarean section rate. That is the purpose of this Robson classification, to identify in which group. Okay, so a twin patient with twin pregnancy comes and she delivers normally, and another twin comes, she has a cesarean. So in twin pregnancy, there's a 50% cesarean section rate. Now you can compare that rate with a different hospital or a different institution or a different country altogether. So that is the purpose of this Robson classification. All right. So all women are classified. Important to remember, all women are classified. And it is a complete perinatal classification. It is not only for cesarean sections, it is for all deliveries. So as I said, in 2014, the WHO proposed the Robson classification system as a global standard for assessing, monitoring, and comparing cesarean section rates within healthcare facilities over time and between facilities. So remember this, it is now implemented by the WHO. That's why it's important for the exam, from your exam point of view, that and because it is being done now in most medical colleges in India. We are now following this classification in the labor ward, in the labor room. So you need to know this. Okay. So this is the same thing. Okay. So this is basically, it will identify what is the use of it. It identifies women, groups them up, classifies the cesarean section rate in each group, and then you can compare it with different facilities. So every woman admitted to deliver in any facility can be classified into one of the 10 groups that are mutually exclusive and totally inclusive. That this means that based on a few basic obstetric variables, every woman can be classified into one and only one of the 10 groups. So there is no there are very clear-cut guidelines. If a woman comes, which group she falls into, and we will discuss those as we go along. Okay, so there's no overlapping of groups. One woman, one group. All right. Now, these are the 10 groups. Okay, now this is where most of you get confused. Even I got confused that how do I remember this? It is so difficult to remember. Okay, so there's group one. I will read out each, and then we will go to the simpler way. How, when a woman comes, how do we classify her into which group? So just let's reread this briefly. Group one is a nulliparous woman with a single cephalic pregnancy more than equal to 37 weeks in spontaneous labor. All right. So basically, she's basically a primary term patient in spontaneous labor, right? So primary term in spontaneous labor. See this a sort of a Wi-Fi sort of sign. This basically means she's in labor, uterus is contracting. The second is again nulliparous. So again primary, again term, more than 37 weeks, who has had labor induced or was delivered by cesarean section before labor. So that means she's a primary, she's a term, but she's not in spontaneous labor. She's in induced labor or has had an elective cesarean. Cesarean section before labor, in other words, basically means an elective cesarean, or basically any cesarean which is done before the onset of labor. So she's not in labor. That's why that sign is not there. Okay. 3 and 4 the same as 1 and 2. The only difference is it is multiparous. So multiparous woman without a and remember these are this multiparous woman 3 and 4 are without previous scars on the uterus. So multiparous woman without a previous uterine scar with a single cephalic pregnancy. And remember these are all single pregnancies. They are not twins or multiple pregnancy. So this is a multiparous, again term, no scar, single pregnancy, again in spontaneous labor. See the sign that she's in labor. So, but the only difference is she's a multiparous. So 1 and 3 are the same. That is primary. This is multi. Number 4, again multiparous woman, again without a scar, with a single baby, cephalic presentation. And remember, these are all cephalic presentations. Okay, cephalic, 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 cephalic. Okay, so this is even this is cephalic. All right. So the single cephalic pregnancy, again term, but again she is not in spontaneous labor. She's induced labor or has a cesarean section before the onset of labor. So this is 1, 2, 3, 4. Primary, primary, multi, multi. Number 5 is all multiparous women with at least one previous scar with a single cephalic pregnancy who is term. So this is basically a previous cesarean, 1 or 2 or 3 or any other uterine scar with term pregnancy with cephalic presentation. Okay, so this becomes a and a single baby, this becomes group number 5. So it's confusing, I know, but as and when we discuss the flowchart of how to go forward, it will become easier to remember. Remember, group number 6 is all primary breech. Primary single baby breech. Okay. All multis with a breech is group number 7. Okay. Primary breech is group 6. Primary breech, multi breech is number 7. This also includes women the previous scar. So if she was cephalic, it will go into 5. If she's breech now, she goes into 7. So 6 and 7 are basically breech. Okay. 6 and 7 are breech. 8 is all women with multiple pregnancies. So all twins, triplets, quadruplets, irrespective of anything else, falls into multiple pregnancy, falls into group number 8, including women with previous uterine scar. Group number 9 is all women with single pregnancy with a transverse or oblique lie. So basically, transverse oblique lie falls into group 9, including those with the previous scar, but with a single baby. And group number 10 is all preterms with a cephalic presentation with a single fetus. So all preterms less than 37 weeks, say a 34 weeks patient comes, she was induced for severe preeclampsia. Okay, so she will fall into this group, single cephalic pregnancy less than 37 weeks. So preterm falls into this category. So it's a little confusing. I know even when I saw it, I was like, oh my God, how will my residents remember this? How will I remember this? It becomes difficult, but over time with practice, and once I show you the flow chart, it becomes easier to remember. So let's see the flow chart. What's the first thing you do when a question is asked on what Robson classification does she fall into? How do we go about doing it? So start here. The WHO has actually given a flow chart. This is the same flow chart which I've reproduced, and this makes things so much simpler. But you should remember how the flowchart goes. What do you need to look for first? The first thing you need to look for is she a multiple pregnancy? Because if she's a multiple pregnancy, okay, if she's a multiple pregnancy, one second, sorry. If she's a multiple pregnancy, so yes, she's a multiple pregnancy. She straight away falls into group 8. So see, twin pregnancy straight away falls into group 8. So remember this, start with group 8. Okay, so start with multiple pregnancy, which is group 8. Very important to remember. Remember this point. Start with multiple pregnancy. First thing in the question, you'll see twin pregnancy is asked, irrespective of everything else. Okay, irrespective of whether she's preterm or whether it is breech or whether it is transverse lie. If first thing you need to see or previous cesarean, is she multiple pregnancy? Don't look at anything else. Straight away mark group 8. Okay, I hope this is clear. So start with multiple pregnancy. So next, no, she's not multiple pregnancy. It's given to a single baby. Okay, then what should you see? Then you should see if it is transverse or oblique lie. Okay, is it transverse or oblique lie? Yes, nothing else you need to see. She straight away will fall into group 9. Okay, I hope this is clear. So group 8, so start with multiple pregnancy. Yes, group 8. No, is it transverse or oblique lie? Okay, then she will fall into group 9. Group 9 for obvious reasons will have 100% cesarean section rate, because all transverse lies, unless you run a version, then it will become cephalic, it will fall into a different group. So transverse oblique lie, obviously there's no other way they can deliver, especially anything more than 28 weeks. So that this will be 100% cesarean section rate. But that is different. What we're discussing now is the groups. Okay, so anything which is transverse or oblique lie, a single baby falls into group 9. So I hope this is clear. How do we start? We start with multiple pregnancy. Yes, group 8. No, is she transverse oblique lie? Yes, group 9. No. Okay, so the question is, she's single baby, but she is breech. So the next thing you look now for is breech pregnancy. Okay, is she breech? Yes. Then what do we have? We have to see another thing. Is she multiparous? Okay, yes, she falls into group 7. Okay, so remember this now. So we start with, what do we start with? We start with multiple pregnancy. Yes, group 8. No, is she transverse oblique lie? Yes, group 9. No, is she breech? Yes. Is she multiparous? Yes, group 7. No, then she is group 6. Okay, so remember this page is important. 8, 9, 7, 6. Remember this order. 8, 9, 7, 6. 8, repeatedly say it. 8, 9, 7, 6. So how do we start? Multiple pregnancy? Yes, group 8. No, is she transverse or oblique lie? Yes, group 9. No, is she breech pregnancy? Yes. Is she multiparous? Yes, group 7. No, she's nulliparous, that is primary breech, is group 6. Remember, group 6 is primary breech. Okay. No, she's not breech. So she's not multiple pregnancy. She's not transverse oblique lie. She's not breech. But she's, then the next thing we see is preterm. Is she preterm? Is her gestational age less than 37 weeks? Yes. Okay. What will she fall into? She'll fall into group 10. Okay. So this is the first thing. This is irrespective of a previous scar on the uterus. Okay. In fact, all these may or may not have a may have a previous scar on the uterus that we're not seeing right now. So how do we start? Again, is she twin pregnancy? Irrespective of anything. If don't get confused. If the question comes multiple pregnancy with the previous cesarean, don't bother about the previous cesarean. Is she multiple pregnancy? Yes, even if she has a scar, doesn't matter, group 8. Okay. Next comes transverse or oblique lie. Yes, group 9. No, look if she's breech. Is she breech? Is she multiparous? Group 7. Nulliparous? Group 6. If none of these are there, next thing you need to ask yourself, is she preterm? Yes, group 10. Okay, so I hope this page is clear. Multiple pregnancy, transverse lie, breech, and preterm. This is the order you will look for in the question. Okay, and this is how you will answer the question. Okay, so she is not, so if she's neither of these, she is term. Okay, then what do we do? Then we go to the next page. What does the next page say? Now see, she's neither multiple pregnancy, she's not transverse lie, she's not breech, and she is not preterm. That means she's term. Next, what do we see? We see her parity. So now we have 5 groups left, 1 to 5. Let's see where the woman can fall. So she's a multiparous woman. What do we see next? So yes, she's a multiparous. Does she have a previous uterine scar? Yes, she's group 5. Okay, so that means term patient with a previous uterine scar with cephalic presentation, single baby, falls into group 5. I hope this is now becoming clearer. Okay. So basically group 1, 2, 3, 4, 5 are all term, are all cephalic presentations. Okay. The difference lies in whether they're nully or multi or have a previous uterine scar. Okay. So I'll repeat, multiparous woman, yes. Previous scar, yes, she falls into group 5. Okay, you can see group 5 in the image. There's a small c written. That is because she has a previous uterine scar. No, so she's multiparous, yes, but she doesn't have a previous uterine scar. Then you see, was the labor induced or was the cesarean section done before labor? Yes, she falls into group 4. Okay, that means she was induced. Say she's a multiparous, shall come at 40 weeks post-dated pregnancy, and labor was induced for her. So yes, she falls into group 4. Okay, so this is group 4, multiparous, single baby, cephalic presentation. Okay, but not a previous scarred uterus. If it's no, she comes in spontaneous labor. That means, so this no means she's in spontaneous labor, multiparous, single cephalic, no scar is group 3. So I hope this is clear. Let us go back. Multiple pregnancy we saw, no. Transverse oblique line, no. Breech, no. Preterm, no. So what's the 5th thing we see? Is she multiparous? Yes, she's multiparous. Does she have a previous scar? Yes, straight away group 5. Okay, no. Was labor induced or was the cesarean section done before labor? Yes, she falls into group 4. Was she in spontaneous labor? Group 3. Now comes to, she's not a multiparous. So now she's nulliparous. Okay. Not a multiparous means she's nulliparous, and then we just have to ask ourselves 2 things. Was the labor induced or cesarean section done before labor? Yes, she's group 2, and no, if she's in spontaneous labor, she is group 1. Okay, so straight away this page is easy. 5, 4, 3, 2, 1. Okay, so let's revise. First thing we see is multiple pregnancy. Is she multiple pregnancy? That means twins, triplets, quadruplets. Is she? So she falls into straight away into, okay, so let me just put this here. Okay, this is what the WH has given, and this is how I reproduced. Okay, but this chart is very important. So this chart, you need to take a printout, you need to stick it up on your walls, you need to take a picture and keep revising this, and this becomes easier every single day. Okay. So it took some time, yes, but once you understand this flow chart, it all makes sense. It's very easy, in fact, now to remember. Okay, with your eyes closed, with my eyes closed, I can easily tell what category the woman will fall into. So multiple pregnancy is the first thing we see. Remember from the previous flow chart, yes, so she's in group 8. Okay, no, she's transverse or oblique lie. Yes, she falls in group 9. Breech, is she a multi? Group 7. No, she's a primary, group 6. Okay, now all of these no, then you come to whether she's preterm. Yes, she falls in group 10. No, she's not preterm. She's multiparous. Yes. With a previous scar, yes, group 5. No, she doesn't have a previous scar, but labor was induced, so section was done before labor, then group 4. No, that means she's in spontaneous labor, group 3. Okay, she's not a multiparous, she's a nulliparous. Was labor induced or cesarean section before labor? Yes, group 2, and no spontaneous labor. So this is basically a primary spontaneous labor, single cephalic, no scar in the uterus, is group 1. So I hope this is pretty clear now. And the more times you revise it, the more you will understand, and it becomes clearer and clearer. So if you get a question in the exam, I had given it in one of the daily questions which we do. The question was, a woman with twin pregnancy comes with the first twin as breech. She's a previous cesarean section. Okay, so what is the Robson classification? So some people wrote group 7 because she was multiparous breech. Some people wrote group 5 because she's a previous scar. Okay, but the correct answer is group 8, because the first thing we need to see is she multiple pregnancy. Irrespective of everything else, the first thing, multiple pregnancy, falls into group 8. Then we see transverse or oblique lie. Then we see breech. Then we see whether she's preterm, then we come to whether she is multiparous or nulliparous, and whether she has a scar, whether labor is spontaneous or induced, and accordingly we group the woman. Okay, so this is how cesarean section audits are being done now. Each group we see as I said in the beginning of the class, say twin pregnancy comes, two twin pregnancy comes in labor. Okay, one of them delivers normally, the other was taken up for a cesarean for whatever reason. Okay, so there is a 50% cesarean section rate in twins. Okay, so now this auditing is also very important in order to basically reduce the incidence of cesarean sections. The higher rate of cesarean section was, when I said in the beginning, was we need to do an audit. So once this auditing has started, it has been found that the main groups where you can concentrate your reduction of cesarean section rates are in group 1 and 2, and also group number 4. So 1, 2, and 4 are one of the major groups where you can reduce the cesarean section rates. Okay, group 5 tells us that the woman already has a scar, so it gives us an idea of the cesarean section rates in the previous few years. If this is high, that means the previous cesarean section rates in the previous years were high. So basically, I won't go to that detail because that is not for your level, but you need to understand the grouping. At your level, you need to know, as interns, as residents in the labor room, you need to understand. That's why it's important from your exam point of view, because they expect you to know which woman will fall into which Robson classification. And the purpose of doing this is to do an audit and see where can we reduce the cesarean section rates in the institute and overall in the whole country. Okay, so WHO says the cesarean section rate in a country should be less than 15%. Okay, so this is about Robson classification. If you do have any comments, if you do have any doubts, please write them in the comment section. Okay, and I will try to clear them up as best as possible. So thank you very much.